Good afternoon. Wake up, wake up, wake up. So the topic is like a tricep and insertion and related lesion. Thank you to invite me. This is a tricep insertion anatomy study. It's like that your paper, right? Correct. Erika. Yeah, I reviewed that. Yeah. So this paper is quite nice because it's easy and make you quite clear. In the past, anatomy of the tricep is quite complicated. The footprint of the tricep, especially in the superficial part, I mean the dorsal part of the tricep tendon, they used to be like this side is shared from the medial head, and that side is shared for the lateral head. But you be concerned just really the superficial size, because the tendon part is stay on the dorsal side of the olecranon. In the between, it will be muscle size, and go further, it can be like a capsule. So in this study, they show many things in there. If you do an arthroscope, when you divide the capsule and you see the muscle, that means the capsule is already gone enough already. So, but that is another way to understand this concept of the footprint of the tricep insertion. I think that you can see something like a olecranon traction spur. You know the olecranon traction spur? You follow me. The presentation of olecranon traction spur can be like a posterior elbow pain. Sometimes it can cause like a loss of elbow extension, and also have a bursitis. And in case that failed conservative treatment, most of the time it's not quite common. Most of the time, we conservative treatment quite success. Olecranon spur excision is success. Where is the olecranon spur? Here is the olecranon spur, but we call this one is a olecranon osteophyte. Okay. This is spur, not menu, and this is osteophyte. This case have some joke, so you can wake up. This case is like a. No. Okay. This male, 30 years old, present with posterior elbow pain. Workup, it show that it have the olecranon spur have some crack inside. So the tender point, clinical is important. Tender point in there. At that time, I didn't do the MRI, and I think that they fail conservative treatment because they take the injection from another way, another place, another hospital many times. So I do like a excision of the olecranon spur. I love minimal invasive surgery, so I do an endoscopic, remove the olecranon bone spur. I think that the magnification of arthroscope, endoscope is quite nice. So we just remove that part. And this is before and after. You see that it's quite clear that olecranon bone spur is gone. The clinical is success. His pain is gone. Unluckily, 8 weeks after the operation, he fell down and fell from stair and then catch the stair. Suddenly he feels so painful and have a bruise on posterior elbow. The tricep is ruptured. This is another case. This is a weightlifter. His arm is huge than my arm. Very strong man. He used to have like a olecranon spur, and they go to another hospital. They make a mini incision and cut and remove that bone spur. And after that, they have like a weakness on the extension, and also have the like a painful in the back of the elbow. And this is when we work up in there, we found that it have like a chronic partial tear of the tricep. In this pain film, in the picture you can see that the tendon is not incomplete, it have an incomplete rupture in the tricep insertion. So at that time, I reconstruction the tricep with the semitendinosus allograft, and also patch the membrane of the allograft too. So olecranon traction spur, like a traction spur, it have form the repetitive forceful elbow extension, and it can cause the tricep tendinosis because it irritates the tricep. So this is another case. This is a male, 37 years old, present with a posterior elbow pain and limit extension. You see that they have two problems. One is have a olecranon bone spur, and another part is elbow extension loss because they have a osteophytes. It's like a bony impingement. So in this case, I do the arthroscope, osteocapsular arthroplasty. And the concern, because I'm learning, we have a lesson from the past two cases and there. So we remove the olecranon spur by endoscopic again, but we adding another treatment. We concerned about that. If we take a work up in the MRI, you see that the olecranon spur, they have some part of the tricep insertion on that spur. If we remove that spur, the tendon is involvement. So it looks like that if you remove that part, it will can easier to cause the tension site failure. If you have load, minimal load in there, the tricep can cause the rupture in there. That this situation and this MRI may be the explanation what happened in that case of in the first one. So we do something like try to avoiding the tricep insertion involvement. So we skip from the direct posterior portal for the osteocapsular part arthroplasty to be used the posterolateral and then accessory posterolateral. Here is a arthroscopic osteocapsular arthroplasty part. We can do on that two portal. So we preserve the tricep tendon insertion. And after that, we move to the bursoscopy or endoscopic in the bursa. So the tricep, we not involvement. We not do anything on harmful on there. And after that, we repair the tricep tendon on the bursal side. It look like a partial tear of the bursal side of a rotator cuff. And this one is like a reinsertion in there. This is the strength of the elbow, the tricep force, quite strong. I try to test in extension, 30 degree, 45, 60, and 90. Yeah, that's me, okay? And this is another case. It's male, 44 years old, posterior elbow pain, limit extension leading to pain and weakness in elbow extension. In the beginning, the first doctor that consult to me, they concerned about the range of motion loss because of the extension deficits. But when I take a look on the X-ray, you see something. You will see this one. I don't think that is a loose body. It's like a fake side of the tricep insertion avulsion. So I go back to the patient and ask, And then he said, yeah, I have a weakness too. Especially when they want to push, like a push-up activity, they're weak. Before develop the symptom of the elbow extension loss, he used to have an injury and have a painful and bruise at the back of the elbow. So you can see that the investigation on there, this one is like seeing some bony impingement and also have the fracture in there. This fracture is not union. It will cause a painful non-union and cause a bony impingement. And you will see that the tricep tendon is floppy and also loss of footpin insertion in there. So what will you do? They have two problems and present with a posterior elbow pain. So we done this. I mean me. We go inside, use the direct posterior for wheeling and the posterolateral to wheeling. So we not need to use an accessory posterolateral portal, but we do the standard posterolateral, standard posterior elbow arthroscopy to do the osteocapsular arthroplasty, because the tricep is already attached to the proximal already, right? And go to capsulectomy, and this is a lateral head. You can see that it showed that have a strongly evident what they have used to have a major injury in his elbow. It should use with the word swap or switch. Yeah, depend on. And the lateral motion is good. And again, go in again to do the endoscopy. This one is look like the rotator cuff repair. It's similar to the rotator cuff repair. I do like a double low, 2 soft ankle in the medial low, try to imagine as the rotator cuff medial low, and the lateral low, I mean the dorsal of the cortex of the olecranon. We use a knotless in there, so the size of the knotless ankle in the lateral low, it be like a 2.5, so it can accept the suture just only two suture inside. So this one is like a double low repair of the tricep. Please believe me, I manage the video. It's not easy and simple like this because it's so shallow in there. And this is the result. He can push up, the strength of the elbow extension come back, and in the MRI, the tricep insertion is show that it's come back to heal. Yeah, that is my talk. Thank you.